Okay, well, it's very nice to see you. Here in Holland, we just had the equivalent of Christmas. I don't know when you celebrate in Poland, but it's a busy time here, so I can imagine it's a busy time for you guys as well. So it's nice to see you on a Thursday night. I'm hoping to come to Gdansk again in January to do a workshop on Japanese pediatric acupuncture. And so I'd like to talk very briefly about what kind of things we're doing and how we practice when we're treating children. And then I can maybe go over a couple of cases, answer questions, and so on. And I have a short slide prepared for this. So let me get this loaded. And
Okay.
there we go. So a workshop on Shonishin. Shonishin is one of the primary methods that we use for treating children in Japanese acupuncture. And one of the things that is important in how it developed is that we have to be really cautious how we treat children. We can't do the kind of things that we do when we're doing acupuncture on an adult. Right? We have to modify our whole treatment approach, the kind of things, the normal needling methods, it's really not feasible to do that. Studies have shown that children have a very high rate of fear of needles and a very high rate of fear of treatment procedures, which means they freak out when they come to a doctor. They don't like it usually. So if we want to do something, it's very important that we find a way of managing that, making the treatment appropriate. I think Shonishin developed out of that need in recognizing that there are, in fact, difficulties using normal acupuncture on kids. So one of the ways that's important is we want to minimize needling, meaning as much as possible, we try not to insert needles. Okay, which means we have to look at how do you do acupuncture without inserting needles. And this is where Japanese acupuncture, especially Shonishin, is really very far advanced, very far developed compared to other styles of acupuncture and acupuncture from other countries. And in part, this ability to use non-inserted needling methods, using tools and techniques that don't penetrate the skin, it's a way of it's exploiting the fact that children are very sensitive. They respond to things very quickly, usually very easily. So it doesn't take much. You don't have to do your normal thing that you do on an adult when you're treating kids. But also at the same time, because they're very sensitive, you have to understand about how to modify what you're doing, how to adjust the dose of it. Normally in the field of acupuncture, there's very little or no discussion about dosage. Okay, I've looked into this topic for 40 years. There's very little published on the topic in the general field, but in Japan, dosage is an important issue that we pay a lot of attention to. Understanding if you have a patient who is very sensitive and you deliver, because they're very sensitive, they don't need very much dose. If you deliver the normal dose, you overtreat. If you can deliver a dose that matches their sensitivity, you can make all kinds of things happen quite quickly. And it's very important to make sure that you adjust your dosage to match the needs of the child. Okay, this is true for adult patients, not only children. And one of the ways that we understand how to judge about dosage of children is obviously their age, obviously the nature of their health problems, these kind of things, what their overall health condition is like, but also it comes from touching. By touching, we can make a diagnosis. By touching, we can understand how easily their body is responding. We can feel the changes in the skin as we start to treat. So rather than put the needles and wait to see what happens, we can monitor those changes on the child while we're doing the treatment because we keep our hands on. All right. And this is really helpful in order to understand what's the optimal treatment for a child, when's it good to stop what you're doing. And then additionally, in terms of treating children, there's another thing that's important. If I have an adult patient, I can say, okay, could you please take your clothes off and lay down on the treatment table and let's get started. It's very easy. It doesn't work like that with children. Very rarely are they so cooperative. They're usually scared. You can't force anything. You can't just do it and wait to see if they're going to complain. You need to make sure they don't complain, right? So it's very important, for example, if I'm working on a child who's moving around a lot, you can't just grab the arm and do the thing that you want on the treatment on the arm and hold the child still. You can't do that. You have to be very flexible. So there's also how to handle treatment of children is another important feature in the use of acupuncture in pediatrics, okay? And when we do treatment, the most important thing is the root treatment. The root treatment is about helping the patient's body return to a healthier condition. In the traditional language of acupuncture, we do needling to regulate the chi of the patient. Okay, so the most important thing in treating children, and maybe in part because they're very sensitive, if we can do a good job balancing the system, helping the child's meridian system and chi system regulate itself, the body naturally starts healing itself. And because children, as I said, probably because of their sensitivity, it triggers changes very easily. And then after we've done the root treatment, we look at some simple branch treatments. What simple thing can we do that's not scary, that's not painful, but that is effective to relieve that symptom? And we do minimal amounts of treatment. We want to make it very light and simple. So when I practice treating children using Japanese style acupuncture, I have three different components. One of them is a Shonishin. The other one is a kind of simplified Japanese meridian therapy. Shonishin is specialized for children using specialized treatment tools. Meridian therapy is a Japanese traditional acupuncture, but we do it in a way that's modified. So it's easy to apply on children, easy for children to receive. There's nothing scary about it, nothing painful about it. And then very simple branch treatments like leaving some of those new Pionex, Sarin Pionex press tech needles and so on. So Shonishin began in Japan almost 300 years ago. It applies light stroking and tapping in fixed patterns. You do, for example, on the back, you stroke down the back. On the legs, you stroke down the bladder meridian, the stomach meridian. On the abdomen, you stroke down the stomach meridian. You also stroke down the arms. You do tapping in certain fixed areas, like everybody, we do tapping around governing vessel Do12. So there are these kind of fixed treatment protocols. Of course, there are restrictions. There are certain kind of symptoms where you can't do this, and there are certain kinds of symptoms where you want to do more of this, right? And we do this treatment with stroking and tapping, working on the surface of the body using these kind of tools. And I know from this museum collection in Osaka, some of those instruments look a little bit scary. Like I think the one at the bottom there looks a bit like a scalpel, but they're not really like surgical instruments. They're applied with stroking, very, very, very softly, very lightly stroking on the surface of the body or very lightly tapping on the skin. Okay. And these are examples of typical tools that we might use for tapping. You use the pointy end of the tool. When I teach this workshop, I usually bring with me, I buy supplies from a needle company, and I bring with me, it's like discount and sell kits So that way, if you study with me Friday, Saturday, Sunday, you can start treating already on Monday because you've got the kit. And these are the three typical tools. You've got three tools for tapping. Here are some typical stroking tools. In this case, you use the rounded edges for the stroking. And when I teach, I show you practically when we're stroking, how soft is it on a baby? How do you increase the pressure on a 1-year-old, a 2-year-old, a 4-year-old, a 6-year-old? As the child gets older, how do you increase the pressure? How do you do the stroking? How do you do the tapping? How do you increase or decrease the dose, right? And there's also stroking with a round instrument. All of these things that I've shown you pictures of here, these are all kind of acupuncture needles, which sounds a bit weird, but they're all kind of acupuncture needles, okay? And as I said, it comes in this fixed pattern. So where you see lines or arrows, that's where you're doing the typical stroking. Where you see dots, that's where you do the typical tapping. And treatment takes on a baby that's a month old, I'm done in 30 seconds, or as long as it takes to turn the baby over. The treatment is incredibly quick. On a 3-year-old that's wriggling around, it might take me 5 minutes because they won't stay still. But otherwise, it's 2 minutes. It's very light, it's very quick, it's very easy to apply. Anyway, the second part of the treatment is a thing called Kerakuchirio, or Japanese meridian therapy. And this meridian therapy uses traditional methods and theories. You decide the pattern of diagnosis. On the basis of the pattern, that tells you what points on which meridians to treat. And there are typically, we do very lightly inserted needles, or I also practice other styles of more advanced styles of meridian therapy, where the needle is held at the skin and not inserted. It's not something you can just do. That's more sophisticated when using that technique on adults, for example. But in meridian therapy, there are 4 basic patterns. This is much simpler than TCM, where there's like 100 different patterns and all kinds of combinations. It's not so difficult to decide which of the 4 patterns shall we treat. Once you've identified the pattern, you apply treatment. And on an adult, as I said, it's normally inserting needles, or in more sophisticated forms of meridian therapy, using these complex non-inserted needle methods. But starting, I think, in the 1950s, one of the meridian therapists developed a special treatment tool for treating kids and babies using what's called a teishim. The teishim, which is the thin part, the bottom part of that instrument, in the picture that just came up, that's a teishim. It's a slightly thick needle, but with a small round ball on the end of it that's placed at the surface of the skin. That's one of the 9 needles from the Ling Shu. And he developed an instrument which there's a spring inside there. So you hold it at the point and you move the spring, you move the instrument, the handle up and down slowly and slightly, a very soft, gentle movement like this, and you can create tonification and draining effects. It's quite an interesting and brilliant treatment method. It exploits the sensitivities of babies, small children. Because that instrument is difficult to get hold of, we normally use the Shonishin. You can see it's almost the same, but it's got a variety of springs in it, okay? And the treatment is holding the instrument at the surface of the skin. You very slowly and softly move the instrument up and down here. You don't let where the instrument touches the skin, you don't let it slide through your fingers. You just let the tiny increase and release of pressure with this movement. And you can see quite clear changes in the child from this. It's very interesting. And then for symptomatic treatment, the easiest thing to do is these new Pionex needles from Serin. Really, Saren should be paying me money to say this. They're brilliant. They're absolutely brilliant. Needles that are 0.3 millimeters long or 0.6 millimeters long. You can use them on babies. You can use them on adults. They're designed specifically so that you can apply the right dose of treatment to the patient. Okay, so it's a tiny needle that's placed on a point that's good for the symptom, and it's left there for 1 day, 2 days, 3 days, etc. It's a quite interesting design. You can see here in the picture, there's a tiny needle on the left-hand side, and on the right-hand side, you can see the plastic handle of it. And the tape is quite good at securing it. Or another method of needling, of treatment for addressing symptoms, a very easy one, is to insert needles very shallowly, very thin needles, shallowly inserted. And in the workshop, I will teach how to guarantee to do it painlessly. Because if you can't insert needles painlessly on children, you shouldn't be inserting needles. They won't let you do it. They won't like it. Okay. They don't want to feel the needle at all. Most kids are quite scared of it. Of course, when the child is older, more mature, they're used to it. There's no fear of needles. They don't mind you needling them, but the babies and small children and so on, it's best if you can avoid causing any discomfort with your needling. And then another advantage of this whole treatment system is it's possible, depending upon the child's condition, the severity, the chronicity of the problem, what's going on, etc. It's possible to teach the parent to do a very simple form of the Shonishin treatment as home treatment. And when you do that, you can make the treatment more frequent because the parent is doing a little something regularly each week at home. So it makes the treatment more active, more effective. But throughout the whole thing, you have to pay attention to dose. It's very important. This is something that we in the workshop spend a lot of time talking about, paying attention to, looking at how to adjust the dosage of everything that we do. I've been practicing for 40 years, more than 40 years as an acupuncturist, almost 40 years I've been treating children. I wrote a book in 2011. The second edition was published in 2016. In the workshop that I will be teaching, you'll learn these 3 components over the 3 days. And for each of the different components, especially the Shonishin and the meridian therapy part, you need to know what it feels like. So I will demonstrate everything on you. And then on the second day, you get to demonstrate everything on me. So you get your revenge on me. But I need to give you feedback to help you understand, did you grasp the way of doing it? And what's really interesting is it seems like you've done nothing. It seems like you've hardly done anything on this baby, on this child, and everything changes. Okay. And if you've got the tools, you can start the day after the workshop treating kids. And you'll find that it doesn't matter what style of acupuncture you use for treating adults. This is a complete system for treating children. It doesn't matter. It doesn't interfere with your normal way of thinking or what you normally do on adults. It's a very easy thing. I know many people from different backgrounds of acupuncture have taken the workshop, and when they're treating a child, they use this stuff. And when they're not treating a child, they do their normal thing. It's very easy to switch. So I thought I would finish this part of the talk here. Stop the screen sharing. And I recently had 2 identical twin boys come for treatment. This was around the end of October, and they're 8 years old. And as you can imagine, identical twins, they do everything together. They have kind of a really close, special connection. And what had happened was they'd been going to school, everything's normal, everything's okay. But in September, the school decided, with discussion with the parents, oh, we should put the kids in different classrooms with different teachers. And from that day, both boys started suffering. They both had emotional distress. One of them had difficulty with his feelings. They both developed poor appetite. One of them developed poor bladder control. The other one developed poor bowel control. They both developed a bit of abdominal pain. They had slightly different variations of the same thing. It was very stressful for them to come into this school, this different change in school environment, right? So as an 8-year-old, I haven't inserted any needles on them. I did the light, simple stroking and tapping. One of the two boys was treated as a lung pattern, which means I tonified lung 9 and spleen 3 on the meridian therapy. And the other boy was treated as a liver pattern. I tonified liver 8 and kidney 10 on him. And then I left a press tack on the ear for stress and on a couple of reactive back shoe points. After 3 treatments, all the symptoms were gone. They were back to normal. The symptom changes started after the first visit. After 3 treatments, I haven't seen them since because they're doing so much better. It's normal when treating children to see quite rapid changes using this treatment method. Of course, if you have a child who's got a really untreatable chronic disease where you can't cure the problem, but you can help them manage the problem, you can help them deal with their stress, their anxiety, improve their quality of life, reduce the symptoms over long term. That's a different story, but many children will see quite rapid change from the relief of their symptoms using these kind of simple treatment